Yeah.
Very good afternoon to everyone. So basically, I am going to present this work as a free paper titled as Outcomes of Randomized Control Trial: Absorbable versus Non-Absorbable Suture Material in Pediatric Cataract Surgery. So I do not have any financial disclosure. So basically, the use of the absorbable versus non-absorbable is very much debatable. However, we know that the entire Western world, they are very much using the absorbable suture. Although in our context, it is actually the need of the hour, but we are still not convinced. So as a part of institutional practice pattern, I try to look at this particular aspect, though it looks very simple, but I think this RCT gives a lot of the value and inputs to change our practice pattern. So we know that the pediatric cataract is one of the most important surgically treatable cause of childhood blindness. Management of childhood cataract remains complex, and the physiology and anatomy of the growing eyes of the children is different from that of the adult. So how different is the pediatric cataract surgery from adult cataract surgery in the context of the use of suture material? So we need to add the surgical step like PPC plus AV. The poor scleral rigidity leads to a reduced wound integrity, and thus the need for the suture to close the incisions and side ports. Needs examination under anesthesia for suture removal. Children are at high risk of trauma to the eye and have more chances of wound lesions, and thereby these n number of complications. Right. So having said that, then what suture material one should ideally be selecting? So it should provide a safe and secure wound closure that is maintained for a duration of a wound healing with minimal morbidity, right? And then decision regarding the suture selection depends upon what is the physical and biological characteristic of that particular suture material, the tissue being sutured, clinical experience of the operating surgeon, and also the practice policies of the institutional or non-institutional practice. So we have these two options. So we try to look at nylon versus Vicryl. Nylon traditionally we are using for decades and decades. Why the Vicryl? Probably this is a synthetic absorbable polygalactic suture, which is the copolymer of glycolide, and it is a braided monofilament, and it absorbs by simple hydrolysis within 8 to 10 weeks. So what are the complications related to suture? It could be loose suture and vascularization, accumulation of suture debris, suture abscess, infiltrates, conjunctivitis, and very rarely, the endophthalmitis. So what is the rationale? So there is only one randomized prospective study that compares, the type of suture material in children's for a shorter duration of follow-up. That is what, the Matalia et al. She has recently published. We plan a systematic randomized comparative clinical trial with, children with kind of a modest follow-up of 3 months. So these are the primary and secondary objectives. It was performed at Miriam Hyman Children's Eye Care Center, MTC campus, LV Prasad Eye Institute, Bhubaneswar. It was over a period of 18 months. So those children who were aged between 3 to 12 years, then pediatric cataract, congenital, familiar, or developmental, and patient willing to give the consent were included. So the study design, after eligibility assessment, the counseling done, then the informed consent was taken, and the sequence generation was done by the simple block, the randomization by a separate coordinator who is uninvolved with the clinical care of the patient. And then they were, randomized into the two groups, group A and B for nylon and Vicryl, including 84 eyes in each group. And then post-operative care as a routine at 1 day, 1 week, and 6 weeks and 3 months, they were followed. However, whenever the loose sutures was, reported, they were removed irrespective of the duration at presentation. So this is one modification. We realize the Vicryl suture needs, the 2-1-1 technique, where first initial 2 throws followed by 1-1. That makes your life easy to bury this suture compared to the nylon, because the Vicryl has kind of the characteristic which are that makes the suture very tight and difficult to bury. So if you look at the result, mean age was 7 years, total number of eyes with suture were 168. And then the total number of, the suture removed, rate of suture removal was almost 31% in nylon group compared to 3.1% in Vicryl. So if you look at the, the complication at 1 week, they are pretty much less in Vicryl compared to nylon. However, suture abscess was seen more common at 1 week with the Vicryl. But the picture changes, still the Vicryl seems to be better at 6 weeks, with suture abscess is relatively less common as the duration keeps on increasing. Astigmatism, this is quite interesting. At 3 months, as well as the pre-operative, if you compare, there is no much statistical difference. Although in the initial, the post-operative period at 6 weeks, it seems the astigmatism is increasing, but at the 3-month follow-up, it is almost equal to that of the pre-operative state of the refraction. So if you look at currently, this is the only RCT which we are talking about in this particular age group. Matalia et al. Had shown that that incidence rate is almost correlating what we got, that is 7% in Vicryl and 34% in nylon. So what is the conclusion? Basically, they are good outcomes with safer than Teno nylon, significantly lower rate of complications, avoid the need for an additional UA, which is very much important in our context for subjecting these children for extra UA examination. Probably that could be the more cost effective and safer for children more than 3 years. And we recommend the modification of tying a knot technique by 2-1-1 throw. That probably helps and gives the good outcome. Thank you very much.
It was a simple suture or a box suture, or
which simple means the knot you are asking about? So traditionally we give first 3 throws, then 1 throw, and then second throw.
That. It's basically across or box suture or just a simple one?
Simple suture, yeah.
And then you bury it in the cornea or in the sclera?
On the corneal side.
Yeah. You follow with very small,
yeah, I mean, by that time, I didn't put that data, but at day 1 and at 3 months, none of this, the sutures, they hadn't had any complications. So, I mean, logically to keep them not removing in the another group for a longer duration seems to be risky in younger children. That's why we chose 3
Have you seen what is the mean time by which Vicryl?
Yeah, so the mean time by which the Vicryl suture started showing complication was...
No, not complication, got completely absorbed.
6 weeks.
In all?
Yeah, in most of them, the 6 weeks, the Vicryl got absorbed.
Percentage.
Yeah.
What was your primary outcome measure? What was your primary outcome measure?
Primary outcome to look for the complication rate and also the rate of removal of the suture.
Also, if it causes astigmatism, then you would like to remove
astigmatism also we looked at. If you see the the previous Matalia's paper, so it has shown that probably as the duration increases, the astigmatism goes down. But in our cohort, it doesn't seem like that. Even at the 3-month follow-up, maybe if we follow them longer, probably we'll have some new thing for astigmatism is concerned.
Your follow-up is short.
Yeah.
So what is your take-home message?
Yeah, so my take-home message is probably, the context where I am working in LV Prasad in eastern part of the country, probably I will shift to the Vicryl. Because I look at the difference, 7% versus 34. And then the need for UA.
Any infection did you see with Vicryl?
Infection, 2 patients, they had endophthalmitis. 2 patients had an endophthalmitis. And that was because of suture infiltrate, the first case. And another one was because of the suture abscess.
And any infection with nylon?
It's a very serious matter.
It was Vicryl?
One in each.
That end off?
Pardon?
Was it Vicryl?
Both. One end of
One in
both the
each.
cases.
One in each.
So usually what happens, I presented the paper in another hall. The main reason is, kind of the improper hygiene and the context that come up with the...
You removed these sutures late?
No.
Or you removed early?
Strategy, whenever the loose suture, you have to
Remove it.
despite removal, probably the abscess and infiltrate had precipitated the endophthalmitis.
Okay.
Gave rise to endophthalmitis, or it was just endophthalmitis and we are blaming?
No. Initially, in the first week follow-up, the patient was doing very well. Later on, he developed, the infiltrate and another case abscess and then endophthalmitis.
What time?
So immediate post-operative, there was no
Infiltrate
endophthalmitis.
in the cornea along the suture.
Yes.
Okay.
It was probably suture induced.
Yes. So that's how the 2 cases they were suture.
Okay, in your study, the minimum age was 3 years, isn't it?
Yes. Yeah.
Not the younger ones.
Not younger one.
Why not? Why you didn't use, or you had used and you observed?
Yeah, I think that is one of the limitation where we didn't wanted to take that call and wait without removing the nylon vein to study it for 6 weeks or 3 months younger age with the similar risk.
So you standardly use only Vicryl for less than 3 years in your setup. No nylon.
Nylon.
Yeah, less than 3 years, it's still we need to look at like how does
Now, what is the present
What is
practice?
the present practice you are doing?
No.
No, in my practice, I am using nylon right now.
Yeah.
That's how we have to, the scientifically prove that probably we need a change of.
There was
in
a
the practice.
literature on using Vicryl earlier, or there was no literature?
No, she has
Written
No,
in
on
material.
Vicryl, there is a prospective observational study by Jyoti Matalia.
Otherwise, there is no other literature, only one study.
Yeah, otherwise in the West they have done, but it is not in the children, in the adults. The Bartholomew et al. Or the other authors, they have published in the adults, but not in the children.
And the protocol, you suture only the main wound or you suture the
All the-
paracentesis
all
also?
the
All three wounds?
two side ports and the main suture.
Okay.
So this the only main indication is that to avoid anesthesia, second anesthesia, because for the
Indication
with the,
huge difference, right?
So
We assume we have that traditional thing. No, these are the best suture. But I think if you see the complication rate, it makes a huge difference. That's how waste they are using.
yeah, understood. The only thing that I found is that so we were using in summer, but do you see an increased reaction like in that area that because the Vicryl suture stands up?
3 months, the Jyoti published that the Vicryl group lives with a scar of the suture tract. However, in our cohort, for both of them, there was a scar. So it's not like Vicryl and the nylon don't develop. Both of them has been shown to be
No increase of steroids you had to use for the Vicryl?
no.
Same dose.
Right. We kept everything as the same.
Same.
Show us any photograph and you shown some pictures, I think that would have been far more convincing. Thank you.
Thank you.
Thank you.
Next one.